Right now, we are checking on your health. UofL Health is partnering with WHAS 11, still offering free blood pressure and face skin cancer checks. Among some of the other health booths that are set up at the Jefferson Mall in southern Jefferson County, they're off the outer loop. Let's check back in with WHAS 11's Connie Leonard one more time at this hour. And Connie, you've been talking to folks and the doctors there. I'm curious, why are they most concerned right now here in the wintertime with those face checks? I think that's very interesting.
Yeah, very interesting, Doug. There's so many great booths out here. I wasn't really sure what to expect, and I got out here, and I can't believe all the things you can get checked out. One of the popular people out here is Laura Jones, who does oncology screenings. So, Laura, we were just talking about the beginning of the year. Talk about what's so important to get screenings at the beginning of the year.
Absolutely. So as people are making New Year's resolutions, it's really important to think about your cancer screening and your risk. So Kentucky, unfortunately, has one of the highest rates of cancer incidence and death of any state in the nation. Top cancers that we see here are lung, colorectal, and breast. For people who have smoked or have a history of smoking, you can start screening at age 50. For colorectal cancer, we recommend screening starts at age 45. And for breast cancer, we recommend screening starts at age 40.
What are people asking you about your finding today that are coming to your booth?
Yes, we've had a lot of young people come out, which is great.
Okay.
And, you know, if you have a strong family history, you don't have to wait until those recommended ages that I just said. So, again, if you've got a lot of cancer in your family, you can come to us for genetic testing, and we can start screening even earlier to reduce risk and get those testings done early.
And that specific type of testing has been pretty popular in the last couple of years. Is it new in the last couple of years?
So we do have a clinic that's focused on breast and ovarian cancer.
Okay.
So for anyone with a strong family history or family history of breast cancer that wants to learn more about their risk, you can self-refer. You don't need a physician referral into the Brown Cancer Center. See one of our physicians, Dr. Brian Dong, and talk about family risk, genetic testing, and what you can do to prevent cancer from developing, or if it does develop, address it early.
Okay. Laura, thanks so much for being on. Appreciate it. All right, Doug, we're going to throw it back to you in the studio, but a lot of interesting stuff out here, and it's nice to be out, right, away from, like, snowed in at home.
The mall sounds busy. You know, Connie, you and I have both known people who've had lung cancer who never smoked a day in their lives, so it's very interesting that when she gave that list of the cancers there that they're most concerned about.
Yeah, Doug was just asking Laura about we're hearing so many people getting lung cancer when they didn't smoke, and you're seeing more of that now.
Yeah, so Kentucky also has high incidence of radon, just naturally occurring in our state. Unfortunately, insurance will cover lung cancer screening and a low-dose CT for folks who have a smoking history of cigarette use. This doesn't really transcend to folks who have not had a strong smoking history, but if you have symptoms, if you're coughing more, you're worried about your risk, definitely talk to your primary care doctor about screening options.
Okay. All right, there you go. Your question answered there, Doug. Was it a question or a statement? I don't know.
No,
but we answered it for you.
You got that very important question answered. Thank you, Connie. Interesting information about radon there. Thank you to you both.
Yes.